All right. So you'll see at the top of the list, we've got sutures. And so what you might remember from, if you already listened to the joint podcast that I made, is that sutures are a type of synarthrosis. So they're a place where two bones come together, and there is a joint because it's two bones coming together, but the joint's not supposed to be movable, it's rigid. And so for the skull, that's really important because your brain lives in there and you don't want it to be squishable in any way. So you'll see that they're listed, the coronal or frontal suture. So just to give you some orientation, also this is as far zoomed out as I can go, so I might put this on a box at some point, but we'll work with this for now anyway. So this is the coronal or frontal suture. It divides the frontal bones from the parietal bones. So if I tip this up and let it adjust, we can see it right here. I'll use the little pointer instead. So that's the coronal or frontal suture. Those two terms are interchangeable. You could use either. Let's see if I can get this light to be a little bit less intense. I will make it a little bit less bright. There we go. And that's nice because then we get some contrast popping out. So the sagittal suture, unsurprisingly, goes along the mid-sagittal plane of the head. So right down the middle. And you can see this one is nice because it's very suture-y, very squiggly, classical suture appearance.
Does that also go into the frontal bone too?
Not usually. This skull is a little bit special, and I'll show you why in a moment. But so in an adult, typically the frontal bones are fused together, and there is no longer any visible suture. That's called a synostosis, where two bones used to be separate and then they fuse. In this case, we have a persistent suture between the two frontal bones, which I will explain momentarily. All right, so on the side here, this bone right here is the temporal bone. And this suture that is dividing the temporal bone from this parietal bone, I'll scooch this down a little bit, from this parietal bone, this is called the temporal suture or the squamous suture. So squamous is referring to the fact that this part of the temporal bone is the squamous portion, and that's because it's thin and flat and scale-like. We do have some disarticulated temporal bones that I'll show you, and you'll see that when you look at them disarticulated, the squamous portion is indeed very thin and flat. It's almost razor-like, in fact. So, temporal bone, temporal or squamous suture. On the back, and this might be a time when I want to make this be higher up, but for context, this is the inferior aspect of this skull, which means that this is the occipital bone. And you can see that joining the occipital bone to the two parietal bones is a suture that kind of makes a point. So that's called the lambdoidal suture, which is a fun word to say. The reason it's called lambdoidal is because the character, the Greek character lambda, looks like a little unclosed triangle, and so it's just named for its resemblance to that. Now, what you're going to notice here, 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 and here is that we have three little bones that are completely enclosed on all sides by sutures. These are called Wormian bones. So on your list, they're going to be below, the first bold term below ear ossicles. They're not indented there because they're part of the ear ossicles. I know that's a little bit misleading. Sutural bones or Wormian bones. These are bones that not everyone has, and of people who do have them, they're not always going to be in the same place. So they're a little bit of an accident of development. It's just a place where an extra ossification center appeared during development, and it creates some weird sort of landscapey little bones that have they look like their own little country.
What you say is like a good, like simple definition for a Wormian bone? Is it just kind of like where extra sutures are made?
Yeah, a bone that's completely surrounded by sutures, and which isn't any other of the major skull bones that everybody has. So there's a couple places in the skeleton where you have the potential to form bonus bones, and this is one. You just get some special extra bonus bones. You may have Wormian bones and just not know it, because no one would have a reason to check unless they were scanning your head or performing surgery on your head, right? So it's possible that we've got these. All right, so these I will only ask you about when articulated. I'm not going to hand you like a puzzle piece shaped bone and be like, which one is this? So you'll only ever see them in context, which is nice because there's only one thing they could be, right? Okay, so here we have a frontal bone. In this case, there's two parts. In adults, this bone is fused. This is not an adult skull, however. I discovered this a couple years ago, and a student brought it up to me during open lab and was like, I see deciduous teeth. Is this a child's skull? And I was like, gosh, I never thought to look. Let me check it out. And the answer is yes. This person was about 12-ish, maybe, at the time of their death. So you can see that there's some wisdom tooth and undescended deciduous tooth right here, and also that their frontal bones are not fused. So probably we got this from one of those Pioneer Cemetery dig-up situations, but we're not really sure. So don't know who this kid was or why they died so young. Big shrug, not sure. Yes?
Can I interrupt?
Yeah.
You're recording. So my niece was born, and her two frontal things were fused together.
Already?
Yeah. So they went in and cracked it open.
Oh yeah, they would need to.
Springs in there to open them. Would that be basically, she should have had that up front, right?
Correct, yeah. So this basically just provides room for expansion so that the head can grow larger. But in that case, it sounds like it didn't happen by accident. So yeah, she would have needed that.
Here, the springs, we would never know, and then they pulled them out.
Yeah. Yeah, so that's just allowed to allow for expansion of the head. Your head actually grows pretty quickly and reaches its maximum size relatively early in development. So for example, if I put my arms up, and I'm only going to do the one because my other shoulder is not great, you'll notice that proportionally my elbow is about at the top of my head. If you ask a little kid to do the same thing, their arm is about as tall as their entire head. One of the reasons we find babies and kids cute is because they have these giant heads proportional to their body. So one of the reasons for that is that your skull attains its maximum size much earlier than the rest of you, so you have to kind of grow into your head. Also, pro drawing tip, if you want to draw a child that looks believably a child, you have to make the head large and the rest of the body like maybe 1 or 2 head lengths. Otherwise, you're just going to have drawn a tiny adult, which is creepy. So, yes.
Is there like a condition where the skull doesn't grow? Like, I don't know how, because like obviously like when you're big, or not like a kid, your head is bigger than your body. But what if that doesn't happen? Like your head like stays the same size. Does that happen or not really?
Wait, when your head doesn't grow, or when it does? Oh.
Like your body grows, but your head just stays small.
I mean, microcephaly is one example of that, and it's part of a. If you have microcephaly, that's not your only developmental problem.
Oh.
It doesn't tend to occur all by itself, but yes, it is possible. Actually, you know what? Since we have a skull and we're talking about skull development, I might as well just go ahead and get out something that we are very lucky to have here. Which are our fetal skulls. so let's compare. So that's the top, and what I'm going to actually put this up on a box so we can look at the whole of them side by side. But what you'll be able to see is the intramembranous ossification in progress, and you can see the fontanelles. I'm just going to dump these in here. And a bunch of other things. And we have another one in here that I'll also grab just for comparison purposes. Again, the exact provenance of these skulls we don't really know, but I have a hypothesis about at least one of them and why we have it. Okay, and let's just do some brightness adjustment so we have. Okay, that's about as good as it's going to get, unfortunately. So we can see parietal bone, parietal bone, parietal bone, parietal bone, and 2 unfused frontal bones, 2 unfused frontal bones. So you notice that the membranous spaces on this fetal skull are quite pronounced. There's a lot of space between them. And on this one, that is not the case. You'll also notice that this one is smaller. So, one cool thing is that you can see this white part that's shiny. That's a place where ossification started and therefore is more progressed and advanced. And we have compact bone. And then you can see these little seams around the edge that are areas that haven't yet quite ossified, giving rise all the way to the sheets of mesenchyme that are the starting point for intramembranous ossification. So, based on the spaces on this fetal skull compared with the more normal spaces on this one, so here's the fontanelle, but you can see that this one is significantly more closed up, which is as it should be. I don't know about this one, but I'm reasonably certain that this one has hydrocephalus, which is a problem with reabsorption of cerebrospinal fluid that causes inappropriate pressure to build up in the cranium, and it pushes out on the fetal head. Sometimes it's only discovered after birth. Sometimes it's bad enough that it impedes development and causes miscarriage prior to birth. So that's what I suspect happened here. One cool thing that you can see about this skull as well, if you look real closely, is that the 2 parietal bones appear to be a little bit overlapping right there. And that's fine. One of the adaptations that fetuses have to get out of the birth canal, which is pretty narrow in humans, we walk upright, and that's caused some trade-offs in pelvic width that makes giving vaginal childbirth pretty difficult. The fetal head can squish a little bit on the way out, and it's okay if the bones overlap a tiny bit just to accommodate the baby's travel through the birth canal to successfully make it out. So that's not uncommon. It's also not uncommon for infants to be born with weird-shaped heads as a result of being stuck in the birth canal for a little while, or the apparatus that's used to extract ones that don't want to come out, me included, is a vacuum with a cone on it to put on the baby's head, and that gives you a cone head. So I had a very pointy head for a while after I was born, and then it settled back into its normal shape after a while. But the first pictures of me ever taken were not that great. It's pretty pointy. So here we have fetal skulls. We're really lucky to have them. They are also extremely fragile, so you are allowed to interact with them, but you must be very, very gentle. And then one of these, maybe it's this one, you can see, if you look very, very closely, the fetal ossicles are tiny ear bones forming, which is pretty cool.
Could you
I can't. It's probably almost, I can't exactly anyway. Based on its size and level of development, so you can see the ossification is nearly complete. This one is about full term. It is a little bit small, but I would clock it at about like 8-ish or 9 months of gestation. So just about ready to be born. This one I'm not sure because the deformation caused by the hydrocephalus makes it a little bit harder to estimate. Okay, so let's continue down our list. So I showed you the sutures. Let's now look at the orbit. So the orbit is just the fancy word for the eye socket. So you can see it here. So the orbit is formed superiorly by the frontal bone, and that's also where the brow ridge is. And then the zygomatic bones, and I'll show you all these bones again on another skull as well, so you have multiple examples. The zygomatic bones, which are here and here, make up the bottom orbit border of the orbit. Then in the back, the sphenoid bone, which I will also show you disarticulated because it's real weird and hard to understand unless you see both versions of it. The sphenoid bone makes up the posterior aspect of the orbit, as well as the maxilla, the lacrimal bones, which unfortunately on most of our skulls are missing. So it would be here and here. So the maxilla and also the palatine bones and a couple others. So there's multiple bones that all kind of come together to form your orbit or eye socket. And then as you can see in the back, there's a variety of holes, all of which I will show you, that do things like provide passage for the optic nerve. So that's the optic canal right there. And right there. And then you have the superior orbital fissure, and then the inferior orbital fissure, which is a little bit hard to see, so you have to kind of tilt the skull downward. Inferior, inferior. So these are passages for things like blood vessels and lymphatics that supply the eye. The optic nerve has its own hole that it goes through. So the calvarium is the name for the skull cap. I think I brought one. Nope, apparently not. I believe I have calvaria over there though, so let me grab one. This box that's labeled calvaria is somewhere. Oh, here's one. Okay. So a calvarium is just this, what you would get if you sawed off the top of the skull. So it consists of the two parietal bones and the frontal bone, which in this case, as you can see, is one bone, not two like here. I will show you the ear ossicles separately in a different video just because they are super duper tiny and I'm going to need to make some adjustments to the audio-visual situation here to make sure you can see them. So let's move on to the frontal bone and we'll just go through the list of the bones and then the individual features of the bones. So the frontal bone, that's easy, it's in the front. So you can see it here. And then at the top of the orbit, there is going to be either a hole or, if the hole wasn't completed during development, a notch. And this one has one of each, which is one of the reasons I selected it. So supraorbital means above the orbit. So in this case, it's a notch. See this little notch right here? So notch. And over here, it's a foramen. This one is all the way enclosed by bone. There's no special rhyme or reason to why one would close and the other wouldn't. So some people have two notches, other people have two foramina, other people have one of each, like this person. It really just depends. The frontal sinus you cannot see from here. You need a mid-sagittal section of a skull to see that, and I believe I have one.
What is the function of the supraorbital notch for the forearm?
There's some nerves that pass through it. All right, so I do have a sagittally sectioned skull here to show you the frontal sinus. However, it's hard to make sense of because there's other aspects of this skull that are broken off. So I'll show you two views of it. So what you can't see here is that this is the orbit. So this area, which is an air-filled space, is going to be the frontal sinus. Not the best view of it. I have a slightly better view of it here. So if you cut off the calvarium low enough on the skull, you can see the frontal sinus pretty well. So you can see if we look at the front of this skull, that this air-filled space is inside of the frontal bone, right about here.
So your skull's like pretty thin in the front, like in that area.
In this area, yes, but the sinus is not going to go all the way across. So the area right above this and the brow bone are actually really sturdy. All right, so let's go turn this over and look at the occipital bone. So here's the view of the occipital bone from the inside, and then I'll show you it from the outside. So it's this, it contains this big hole called the foramen magnum, which is Latin for big hole. So that's easy. So here we have the occipital bone. The foramen magnum is this large hole through which your brainstem passes as it becomes your spinal cord. And then on either side of the foramen magnum, here and here, we've got the occipital condyles. So these are going to be the condyles, and we can see if I turn this a little bit, you can see that they're sort of there, knuckly. And those are going to be the condyles that articulate with the superior articular facets that I showed you on the atlas, or C1. So you might remember the C1 articular facets are kind of cup or saddle shaped. And so those condyles rock back and forth in those really nicely. All right, and then finally on the occipital bone, you have something called the external occipital protuberance, which if I turn this skull to the side, you can kind of see it's right here. I will also turn it this way. So what you would see if you were able to zoom in on that, and I'm going to try and make this a little bit off, see if I can catch the shadow on it. The lighting situation in this is difficult. There we go. So you can see right there, there's this little nubbin. And if you were to hold this, and you will see these when you interact with the skulls directly, it's a little lump. So you can feel this on your own head, the external occipital protuberance. The reason it's there is because it's a place where a bunch of your neck muscles attach to stabilize your neck and allow you to move your head around and keep your neck posture stable relative to the rest of you. And so for that reason, because it gets pulled on by muscles all the time, it develops a little sticky outy bit. So here's another view of it, external occipital protuberance. The external occipital protuberance is one way that you can sex a skull. Male skulls tend to have a more pronounced external occipital protuberance, just because of having larger heads and larger neck musculature. Not always, but typically. So when you're trying to sex something like a skull, you just generally want to sort of pick a bunch of features to look at rather than just one, similar to the pelvis. But the external occipital protuberance is one way to do that. Okay. So, parietal bone is just parietal bone. Unlike the rest of the skull, they're pretty unremarkable. So, there's one per side. They kind of just make up the helmety portion of your head. They are the largest cranial bones, but also the least interesting. So here's another view. on this calvarium. Parietal bone, parietal bone. Okay, so the ethmoid bone. Now we're getting into weird-shaped bone territory, and this is probably the place where many of you are going to struggle a little bit more, just because these bones are shaped super strangely. They're not very intuitive, but if we practice, you'll be fine. So the ethmoid bone is especially like that because it sits right in the center of your face. So immediately behind the bridge of your nose, back here, and it makes up part of your cranial floor, so what you see when you look into the skull from the top, like so. And then the rest of it is sort of vaguely cube-shaped and filled with lots and lots of air cells. So when you pull it out of the skull, it really doesn't look like much. It almost looks like just a broken skull piece, but it is a bone. So you'll notice that on your list, it says things like crista galli, which if you are able to see the jazzy etymology guide that I have under the screen here, and I will pull that back up afterwards, means the crest of the rooster. So let me see how well I can get this to focus. Actually, that's actually pretty good. Okay, so if we're looking down into the cranial floor, this area right here